not giving up the fight to repeal and replace Obamacare. Instead, he has a path forward, inviting all GOP senators to lunch today to work on a brand new plan. One of those senators is Kansas GOP Senator Jerry Moran. He joins us right now, but what we can expect. And Senator, I got to start with you and Senator Mike Lee really made news as the president was talking about a strategy in the hopes to pass the replacement for Obamacare. At the White House, word came that you were out. You weren't going to vote for this bill, therefore crushing it. Who did you communicate with, and did you realize that this would embarrass the president?
We've had a number of conversations with the White House, including the Secretary of Health and Human Services, Tom Price, but also informed the White House-led shop and the whip's office in the United States Senate of what was going to transpire that evening. So my view is that it was an opportunity to express what I had concluded, which was this bill is inadequate in its repeal of the Affordable Care Act. This bill is inadequate in the replacement of the Affordable Care Act, Obamacare, and it would not get my vote in the end. Therefore, people needed to know that up front so that we could move in a different direction than where we were going.
True. However, you know the limitations because you only had 52 votes and couldn't get the 60. And you know the limitations because of the parliamentary procedures that were in. Do you feel as though leadership wasn't listening to you? Or do you feel as though you offered things and it didn't even matter?
It's very difficult to find the solution. One thing that can happen in these negotiations trying to get 51 votes is it begins to shift to not what is in the bill, but how to win a senator's vote. And that generally involves money. That's not a good way for us to develop health care policy. How to improve the chances that more Americans have access to affordable health care is not to get in the position in which senators are being, what does it take in the sense of what more money can we provide to get your vote? What we need to do is have a policy that is conservative and innovative, right, that takes the points of view of a lot of folks into account, and not only repeal the Affordable Care Act in a more full way, but to replace it with something that will lower premiums. Because my concern is if we don't get both right, then Republicans have their stamp of approval on a lot of involvement in health care, 1/6 of the U.S. economy.
I hear you,
and
Senator.
Americans are still mad that nothing happened to help them.
Right.
It lends itself toward moving. Republican plan didn't work. Democrat plan didn't work. Let's try universal care, which I think is the terrible mistake.
Right. They're not happy right now, I'll tell you that. And now there's going to be a repeal opportunity, a flat repeal, which is going to take, will you vote for repeal?
I will.
Do you think there'll be enough votes? What do you say to the 4 at least that won't?
Well, I mean, each senator will need to make up their own minds, obviously. But I made a commitment to Kansans. I voted for repeal before, and I believe it puts us in a position in which we would have leverage with Democrats as we try to craft what the replacement is. All 100 senators, following expert testimony and congressional hearings, puts us in a better place to get a follow-up to the repeal, which would be a good replacement.
Senator, you've been in an eye of the storm, and thanks so much for getting up with us and explaining what was behind your decision and your future decision. I appreciate it.
Thank you for the conversation.
You got it. More